The coronavirus pandemic is still far from over despite the availability of safe and effective COVID-19 vaccinations, and countries affected by the conflict are in danger of being left behind, according to the United Nations Security Council. On Monday, the UN Security Council ambassadors met via video links to review the implementation of resolutions of the Secretary General's appeal for a global ceasefire during the crisis and the cooperation to facilitate vaccination access. Let's hear details of that in this report.
Reports have indicated that although widespread vaccination is critical to ending the pandemic, some areas are left behind, especially conflict areas. Experts have also observed that misinformation about vaccines, including that they cause infertility in men and women, has contributed to vaccine hesitancy in many countries, including South Sudan. Ted Chaiban, Global Lead Coordinator for COVID-19 Vaccine Country Readiness and Delivery, says the next 6 months are critical in the quest to overcome the COVID-19 challenges. Chaiban highlighted the need for urgent action this year.
In 2022, we must take the rapid action needed to accelerate vaccination. The window of opportunity is gradually closing. We risk losing the momentum and failing on vaccine equity. The COVID-19 Vaccine Delivery Partnership is focused, amongst others, on 34 countries which were at 10% or less full vaccine coverage and face the biggest challenges to increasing vaccination coverage. The goal is to vaccinate all adults and adolescents, starting with the elderly, healthcare and other frontline workers, and those with underlying health conditions who are at the highest risk from COVID-19.
The Global Lead Coordinator also said addressing low vaccine rates requires humanitarian priorities. Meanwhile, Dr. Esperanza Martinez at the International Community of the Red Cross also briefed the Council members via a video link. Dr. Martinez indicates the need to invest in conflict preparedness and fortifying the building blocks of the health systems.
Health systems torn apart by conflict are less able to contain the spread of diseases across front lines and international borders. Vaccination and other health activities in such contexts are incredibly difficult to carry out. Furthermore, many people in conflict settings are overlooked in public health responses, including people displaced, detained, or living in areas controlled by non-state armed groups.
Dr. Emmanuel Ojwang, Health and Nutrition Coordinator at CARE South Sudan, called on the international community to augment efforts in providing humanitarian access to most vulnerables.
To ensure safe and unhindered humanitarian access to all people in need. This is essential to create the enabling environment for equitable vaccine delivery in conflict, post-conflict, and humanitarian settings across Africa and beyond. Second, ensure that COVID vaccine costing models and budgets cover all aspects of delivery and reflect the real-world costs of rolling out the vaccines to the last mile. This must include investments in frontline healthcare workers, community outreach.
More than 11.1 billion doses of COVID-19 vaccines have been administered globally, and 124 of the 194 WHO member states have vaccinated more than 40% of their population, and 51 countries have reached more than 70% of their population. Reporting for Eyeafrica News, I am Yahya Jammeh.